Hello everyone. So what are the requirements and teaching tips for junior clerkship in internal medicine? In this video, I will talk about these clerkship requirements in 4 parts. Number 1. Required clerkship cases. Each student should be assigned up to 2 to 3 patients with different problems. Student must see patient with each of the following 14 conditions and perform workups over 7 weeks. These 14 conditions include patients with different chronicity, symptoms, organ dysfunction, and situation. Acute medical illness like acute MI, acute stroke, or acute asthma exacerbation. Worsening of chronic medical problem, for example, progressive COPD or CHF. Patient with multiple medical problems such as CHF, diabetes mellitus, hypertension, osteoarthritis, and obesity. Patient admitted because of lack of access to primary care, social issue, like lack of transportation or an inability to pay copays. Abdominal pain, which could be due to pancreatitis, cholecystitis, acute abdomen, spontaneous bacterial peritonitis, pelvic inflammatory disease. Chest pain due to cardiac, acute coronary syndrome, aortic dissection, pleuritic, GI, musculoskeletal, etc. Shortness of breath, which could be due to cardiac, pulmonary, or anemia cause. Fever, it can be due to infection or medication induced. Altered mental status, for example, delirium, dementia, intoxicant, and medication. Metabolic problem like thyroid disease or PCOS. Liver disease such as hepatitis or cirrhosis. Kidney disease like acute kidney injury, CKD or glomerulonephritis. HIV/AIDS, which will include establishing the initial diagnosis through screening ELISA and confirmatory testing Western blot, then knowing the different cell count cutoffs and what opportunistic infection the patient is at risk for, depending on their CD4 count, as well as knowing what prophylactic medication to administer depending on the CD4 count as well. The last workup on the list is geriatric syndrome, which includes falls, incontinence, and memory problems. The second part of clerkship requirements is the clerkship objectives. Not only it is important for the student to see the cases we mentioned, but they should also learn how to perform the following clinical skills: to obtain medical history and perform physical exam appropriately detailed, accurate, and efficient. Compose accurate, complete, well-organized notes that includes history and physical note, progress note which indicate how the patient condition is doing, improving, worsening, or unchanged, discharge summary which describe the clinical course, pending labs, and follow-up. Another objective is to interpret diagnostic test result by determining how the results should influence the patient evaluation and management. For example, renal function, acid base and electrolyte disturbance, arterial blood gas interpretation, peripheral smear emphasis on approach to anemia, liver test interpretation, basic EKG interpretation, rate, rhythm, access, interval, recognition of AV blocks, bundle branch blocks, ischemia/infarction, electrolyte disturbance, ventricular hypertrophy. Students should be able to recognize normal landmarks on chest radiographs and be familiar with the radiographic finding in atelectasis, CHF, masses/lung cancer, pneumonia, and pneumothorax. Students have to develop differential diagnosis that is rank ordered from the most likely to the least likely, and each diagnosis supported by diagnostic studies. Then develop diagnostic workup that incorporates probability-based thinking. Once diagnostic workup and differential diagnosis is completed, student will be expected to formulate therapeutic plan that incorporates evidence-based medicine and patient preferences. And finally, deliver accurate and organized oral presentations by practicing presentations with the intern and review the diagnosis and evaluation plan prior to the rounds. Part 3 of clerkship requirements is physical examination. Students should ask their attending/resident to observe them perform the following exams: full cardiac exam, pulmonary exam, and abdominal exam. The fourth part is the student assignment. The list of the assignments students have to do during their internal medicine clerkship include medication reconciliation, pain management assignment, substance withdrawal assignment, observe sign-in and sign-out, compose patient sign-out, post-discharge phone call, high-value care assignment, near-miss/adverse event report by submitting event to Canvas and clinical site. Also, students have to do required aquifer cases, Institute for Healthcare Improvement IHI cases, Agency for Healthcare Research and Quality cases, complete weekly reflections, for example, individual performance and contribution to team, personal well-being during rotation. Another required assignment is formative feedback form. And finally, students have to identify, write, and submit an abstract for submission to an upcoming meeting for extra credit.